Hello everyone, I am Dr. Rachita Munjal, Senior Consultant, Birla Fertility and IVF Gurgaon. Today we'll talk about what injections, what medications are recommended after the procedure of embryo transfer in IVF. Embryo transfer is the final step in IVF procedure and the most crucial step. And that is why there are a lot of emotions involved in it, wherein the couple is very emotional whether pregnancy will be positive or not after the embryo transfer procedure. So that is why we all, the couple, your fertility specialist, team, everyone put in all the effort to make it pregnancy positive. Sometimes even couples ask, you ask me whatever to do. You ask me, I will take any injection, any medicine, any precautions I'll follow to make it happen. But always the doctor will follow the scientific evidence to prescribe you the right medication and right injection. Let's understand about it. So the IVF procedure involves three main steps. First is ovarian stimulation, where the ovaries are stimulated and the egg retrieval procedure is done. After the egg retrieval, eggs and sperms are fertilized in the lab and embryo is formed. And then these embryos are planned to transfer back into the woman's uterus, which is called embryo transfer procedure. Embryo transfer procedure can be fresh or frozen. Fresh embryo transfer means in the same cycle when the eggs are retrieved and embryo is formed, in the same cycle embryos are transferred into the uterus. Whereas frozen embryo transfer means egg and sperm are combined, embryos are formed, embryos are frozen and kept in the lab for some period of time, and then the frozen embryo transfer is done. So your doctor is the right person to decide whether you are the right candidate for fresh embryo transfer or frozen embryo transfer. Now coming to after embryo transfer procedure, what injections, what medications are prescribed? So the most important medication or injection prescribed is progesterone. Progesterone supplementation can be given either by oral route or by vaginal route or injection route. Injectable can be intramuscular or subcutaneous. So generally your doctor will prescribe you two modes of progesterone. It can be either vaginal and injectable or vaginal and oral or injectable and oral, depending on the medical condition. Now, why progesterone is important to be given after embryo transfer? So what happens is in natural conception, when you ovulate, ruptured egg produces progesterone in the body, which supports the pregnancy. But in IVF pregnancy, progesterone is not formed, or when there are supernumerary eggs in fresh embryo transfer, there is luteal phase defect. So for the luteal support, progesterone is necessary to be given after embryo transfer procedure to support the pregnancy. The other medications which are prescribed are your prenatal vitamins, folic acid, or sometimes in the form of injection, your doctor might prescribe you low molecular weight heparin, but which is prescribed only in certain conditions like repeated miscarriages or repeated pregnancy losses or repeated implantation failure. So the success rate of embryo transfer depends on certain things. The most important is embryo quality, the embryo grading, which depends on the egg quality and the sperm quality. The second important factor is endometrium or your uterine factor, which is the baby's bed, which will hold the baby. So your endometrium has to be optimally thick with optimal blood supply in it for implantation to happen. Third is embryo placement, which depends on the embryo transfer procedure. So that is why embryo transfer procedure is a very crucial step. And lastly, the embryo endometrial interaction, which happens in the body. This is a reaction which happens between the embryo and the endometrium within the body. So these are the factors which will decide whether your pregnancy will happen or not. So don't worry about that I can take any injections, any medicine to make it successful. Your doctor will prescribe you the right medication, right injections for you after the embryo transfer procedure to make it successful. Thank you.